Last winter, a 72-year-old grandfather named Robert walked into a clinic convinced nothing was wrong with him. He wasn't in pain. He wasn't sick. He wasn't bedridden. In fact, he told me, "Dr. David, I think I'm doing pretty well for my age." But then he casually mentioned something. He was waking up 3 times every night to use the bathroom. His ankles seemed swollen in the mornings. And lately, his legs cramped so badly at night that they would jolt him awake. He laughed it off and said, "That's just getting older, right?" 6 months later, Robert was sitting in a dialysis center watching a machine do the work his kidneys could no longer do. And here's the part that should concern every adult over 60. The warning signs were there. His body had been sending them for months. Mostly at night. He simply didn't recognize them. So before we continue, take a second to subscribe to the channel and turn on notifications. Every week, I share research-backed health information designed specifically for adults over 60 so you can stay healthier, stronger, and independent longer. And stay with me until the very end because warning sign number 5 is the one that concerns me most. It's also the sign that sends thousands of seniors to the hospital every year. Now let's begin. Your kidneys are extraordinary organs. Every day they filter roughly 200 quarts of blood, remove waste, regulate blood pressure, balance minerals, and help keep your bones, muscles, and heart functioning properly. But unlike many organs, your kidneys rarely scream for help. They whisper. And those whispers often become noticeable at night. Warning sign number 1. Waking up to urinate 2 or more times every night. If you're over 60, this may sound familiar. You go to bed tired. You finally fall asleep. Then suddenly you're awake. 1 trip to the bathroom becomes 2. 2 becomes 3. Some people are getting up 4 or 5 times every single night. Most assume it's aging. Some blame the prostate. Others blame drinking water too late. But here's what many people don't know. Healthy kidneys reduce urine production during sleep. When kidney function begins to decline, that process becomes less efficient. The kidneys lose some of their ability to concentrate urine, causing you to produce more throughout the night. Imagine trying to recharge your body while someone keeps pulling the plug every 2 hours. That's what repeated bathroom trips do to your sleep. Poor sleep increases inflammation, weakens immunity, raises blood pressure, and puts additional strain on the kidneys themselves. If you regularly wake up 2 or more times every night, don't ignore it. And I'd like to ask you something. How many times do you usually wake up to urinate? Comment the number below. I read as many comments as I can, and your answer may help someone else realize they're not alone. Now here's where things become even more concerning. Because many people who experience warning sign number 1 also experience warning sign number 2. And that's exactly what happened to Robert. Warning sign number 2. Swollen ankles, legs, or puffy eyes in the morning. One morning Robert noticed his socks were leaving deep marks around his ankles. He assumed it was because he had been sitting too long watching television. Weeks later, the swelling was still there. Then his wife pointed out something else. His face looked puffier when he woke up. What was happening? When kidneys struggle to remove excess sodium and fluid, that fluid has to go somewhere. Often it settles in the legs, ankles, feet, and around the eyes. At first the swelling may be subtle. You might notice your shoes feel tighter. Your rings may feel snug. Your socks may leave indentations that weren't there before. Unfortunately, many people blame circulation problems and never consider their kidneys. The danger is that fluid retention often develops gradually, making it easy to normalize. But your body is not designed to hold onto excess fluid. It is trying to tell you something. If you press your finger into the swollen area and a small dent remains for several seconds, that can be an important clue worth discussing with your doctor. Now before I reveal warning sign number 3, let me tell you about another patient. Frank was a 68-year-old retired electrician who believed his swollen ankles were caused by standing on concrete floors during his working years. He ignored the swelling for nearly a year. Then something else started happening at night. Something that made sleep almost impossible. Warning sign number 3. Restless legs that won't let you sleep. Frank described it as a crawling sensation under the skin. Every time he tried to relax, his legs felt like they needed to move. The discomfort became so intense that he would walk around the house at midnight just to get temporary relief. Sound familiar? Restless leg symptoms are significantly more common in people with chronic kidney disease. Because declining kidneys can affect iron balance, nerve function, and the buildup of waste products in the blood. These changes can irritate the nervous system, especially when you're resting quietly at night. Many people receive sleeping pills or medications for restless legs without anyone investigating whether kidney problems are contributing to the issue. If your legs seem to have a mind of their own after sunset, don't dismiss it as a strange annoyance. It may be part of a bigger picture. And now we come to the symptom that shocked Margaret, a retired school teacher who thought she simply needed more vitamins. Warning sign number 4. Severe nighttime muscle cramps. Margaret was waking up 2 or 3 times every week with agonizing cramps in her calves and feet. She tried magnesium supplements. She tried bananas. She drank more water. Nothing worked. What she didn't know was that her kidney function had quietly declined. Your kidneys help regulate important minerals like calcium, phosphorus, sodium, and potassium. When those minerals become unbalanced, muscles can react with painful contractions. These are not ordinary cramps after exercise. They often strike suddenly during rest. They can be intense enough to wake you from deep sleep. And they frequently return night after night. Margaret later told me the pain was so severe she was afraid to go to sleep. Once her kidney issues were identified and properly managed, the cramps gradually improved. That's why recurring nighttime cramps should never be brushed aside as simply getting older. And now we arrive at the warning sign that concerns me more than any other. If you're over 60, please pay close attention. Warning sign number 5. Waking up short of breath or feeling unable to breathe while lying flat. This symptom can be frightening. Some people wake suddenly gasping for air. Others notice they need 2 or 3 pillows just to sleep comfortably. Many don't realize the change is happening because it develops slowly. Here's what can occur. When kidneys fail to remove excess fluid effectively, that fluid may begin accumulating in the lungs. Once that happens, breathing becomes more difficult, particularly when lying flat. I've seen patients ignore this symptom for months because they thought it was simply aging, allergies, or poor fitness. Then one night they end up in the emergency room struggling to breathe. If you are experiencing shortness of breath along with swelling, frequent urination, restless legs, or muscle cramps, do not wait. Contact your healthcare provider promptly. Your body may be warning you that something serious is developing. Now here's the good news. Early kidney disease does not always mean kidney failure. In many cases, progression can be slowed or even stabilized when caught early. That's why awareness is so important. Here's what I recommend. For the next 7 nights, keep a simple notebook beside your bed. Write down how many times you wake up to urinate. Note any swelling, cramps, restless legs, or breathing difficulties. Then schedule a conversation with your healthcare provider. Ask about your eGFR, creatinine level, and urine protein testing. These simple tests can provide valuable information about kidney health. Also review any medications you take regularly. Certain pain relievers can place additional stress on the kidneys, especially when used frequently. Reduce excess sodium, stay appropriately hydrated, manage blood pressure, and if you have diabetes, keep blood sugar under control. These steps may seem simple, but they can make a tremendous difference over time. Remember Robert from the beginning of this video? The tragedy wasn't that his kidneys were damaged. The tragedy was that his body warned him for months and he didn't know what the warnings meant. Now you do. So I want to hear from you. Comment checking if you're planning to ask your doctor about a kidney test. Comment symptoms if you recognized one or more of these warning signs. And comment sharing if you're going to send this video to a parent, spouse, sibling, or friend over 60. Your comment helps this information reach more people who may desperately need it. If you found this video helpful, subscribe to the channel, like this video, and turn on notifications. Every week, I share practical health information designed to help you live longer, stay independent, and protect the health you've worked so hard to build. Take care of your kidneys. Take care of yourself. And I'll see you in the next video.